I'm Nancy LaVigne. I'm director of the Justice Policy Center at the Urban Institute, and today I'll be talking about prisoner reentry and corrections policy and what we know about what works. Now, in thinking about what works, I like to categorize them into programs and policies and practices. And in doing so, it's helpful to think about what works specifically with regard to individual needs and risks, and ultimately preventing the outcomes that we don't want to see, which is reoffending, and encouraging those that we do want to see, which is successful reintegration into society. Now, I've spent the better part of my career studying programs on what works, evaluating them. My colleagues at the Urban Institute have done the same, and so it's a little disappointing perhaps to say that what works is pretty obvious. That is to say, most of the things you would expect to work do work. Name any kind of intervention that's at all logical, be it securing housing for people when they're released, substance addiction treatment programs, education, employment readiness. Every single type of intervention has been evaluated by someone and found to be effective. Even when you weed it down to only those studies that are the most rigorous, we still find that to be the case. So do we need any more research? And do we know everything we need to know to be able to help folks succeed on the outside? Well, the answer is that it's a little bit more nuanced. So even though there are programs that work and have been found to be effective, the big question is for whom? And that's where it gets more interesting, a lot more nuanced. What we know is that different programs work for different people, and that it's very ill-advised to just assume because a program works, you should deliver it to everybody. Let me take the example of Maryland, and specifically Baltimore. Several years ago, we conducted a study of prisoner reentry. We set out to really understand all the factors that go into reentry success and failure, far beyond studies that predated it that were looking specifically at just the recidivism outcome, yes or no. And to do so, we interviewed people behind bars and followed them over the course of a year after their release into the community. And we interviewed their family members, and we learned a lot about their backgrounds, their histories, what criminal histories they had, and what types of programs they accessed behind bars. And throughout all of that, we learned some very interesting things. So we interviewed both women and men. And one thing we learned was that among the women we spoke with, 40%, 4 out of 10, reported that they had engaged in daily heroin use in the 6 months leading up to their incarceration. 4 out of 10. It's super high. What does that tell you about what works for whom? Well, if you have scarce resources like treatment, which there's just not enough of it to go around, you want to focus on those 40%. That's perhaps obvious, but it gets even more nuanced than that, because criminal justice clients don't just have needs like substance addiction issues, they also have assets, and they also have factors in their lives that can motivate them to succeed or fail. So another part of the study that we did included what researchers call open-ended questions. So we had one at the end where we asked them, women and men, what are you most looking forward to upon release? And the women, the vast majority of them had the same answer. And the answer was reuniting with my kids. And it didn't have to be minor children, it could have been their adult children, but they were motivated by reuniting with their children. The men, on the other hand, and this is true, top answer was divided between pizza and calling my own shots. So this is not to disrespect men, but you can see how different people, men, women, people who are addicted or not, will respond to different types of treatment and programs. And that's really critical. It's an important nuance, and especially since we're talking about scarce resources like money to provide programming behind bars. It also supports a philosophy that's borne out in practice that using risk and needs assessment tools that are validated, they're quantitative tools, can really help guide that decision about who gets what. And that it's critical not only from a perspective of allocating resources, but also in preventing harm that you can actually cause to individuals by giving them something that you think is good. Now, it seems to fly in the face of reality or conventional wisdom, but it is the case that, and some studies have found that focusing on low-risk criminal justice clients can be harmful, can actually be criminogenic. So take, for example, a landmark study in Ohio that looked at people exiting prison, some of whom went to halfway houses, others did not. The research found that the halfway houses for medium and high-risk clients led to more desirable criminal justice outcomes. That is to say, those individuals were less likely to reoffend compared to matched counterparts that did not have access to halfway houses. But when they looked at the low-risk people, they actually found the opposite. Low-risk clients who went through halfway houses ended up offending at a higher rate than low-risk clients who did not. Now, why would that be? It had me scratching my head for a while until I had the opportunity to meet a gentleman who had been recently released from federal prison and had returned to the District of Columbia. And this gentleman shared a real tale of woe. Now, I don't know a lot about him. I don't know anything really about his background. I don't know what got him to the federal prison system. I don't know how extensive his criminal history was. But I would venture to say that by most standards, he would be called a low-risk client. He had a very strong family support system. He had found himself a job prior to his release through contacts with friends and family. And yet he was required to go to a halfway house. His tale of woe was that the halfway house was located 3 bus rides and an hour and a half away from his job. So every day he had to navigate that commute. Moreover, he was required to report to mandatory substance abuse treatment on Thursday afternoons at 5 o'clock at the halfway house. So he had to tell his boss, who had already taken a big gamble on him by hiring someone recently released from prison with a record, to say, okay, in addition to hiring me, I need to leave at 3:30 every Thursday. You can imagine the challenges that that creates for successful reentry. Which leads us to policies. Not only is it important to use these risk and assessment tools right, but you also need policies that give those tools teeth and that mandate their use. And across the country, we've now seen a real shift in philosophy in state legislatures where they're beginning to pass reforms, including ones that mandate the use of risk assessment tools, mandate the use of evidence-based programs, and more importantly, are beginning to focus on what is the most critical aspect of turning around our criminal justice system, and that's what I call pre-entry, figuring out who really needs to be in prison in the first place. Because in the interest of doing no harm, prison is harmful. There are no studies that have found that prison alone is rehabilitative. There are studies that show that certain programs that happen in prison might help, but there are studies that show that prison is criminogenic. So these state legislators and others are beginning to realize that prison is harmful, it's costly, and it's at the expense of other important priorities, and they're starting to turn that around. They're doing that with the support of evidence and the support of programs that work. Thank you.